The only thing that changes the skin barrier is moisturization, and it's the same for humans. There are strays everywhere. You learn to be afraid of dogs because they chase you on the street at night. I've been bitten by dogs twice. It is a long journey, and I think you really have to find the right vet for you.
Welcome, Aneka, to the Dog Mum podcast.
Thank you.
This has been the conversation that I have been waiting for.
It's been a long time coming.
It's been a long time coming, and you know that I'm a big fan of the Fur Love. I really am.
Cool.
No BS. Absolutely love the brand.
Thank you.
So to have you on and talk about you, the brand, and everything that you've done to create it is amazing.
I'm happy to be here. Thank you for having me.
Okay.
Been looking forward to it. Yes.
It's an absolute pleasure. So tell us a little bit about you, just a quick intro. So what do you do in both lives?
Well, God, where do I start? But I'm a surgeon by profession, I suppose, is where I started. I trained in New Zealand, worked in Australia, Europe, France. And I always knew I loved the job. I adored it. I wrote a book about it, but I always knew that it was not going to be my forever. And so about 5 years ago, even longer than that, I had a dog with dermatitis, my beloved Charlie, and she had dermatitis. And she needed something. She needed skincare, and we might go into the story a bit later, but simply she needed skincare, and it didn't exist. You know, everything was just unsatisfactory, plastic bottles on the shelf, veterinary to prescribe products. And I know human skincare and I know human skin. And what she really needed didn't exist. So we made it. And that was now about 5 years ago. So I've kind of juggled this life between being a surgeon. I spent a year, actually more than that, writing, launching the company. And now we're in France and the UK.
Amazing. So what was that exact spark when you said, I have to do this?
It was more sort of a process because I loved her. I love her. She unfortunately she's not with us anymore, but she had this problem, and we were at the vet nearly every week. She had dermatitis. She was itching and scratching. We were on antibiotics, back and forth to the vet, dropping hundreds of pounds every week. And then I realized that actually she was behaving like a human child with eczema. And lo and behold, a little bit of research demonstrated that dogs and humans have the same skin at the level of pathology of dermatitis. But we know how to manage human dermatitis, and moisturization is key. But no vet told me that. And no, there were no products on the market that existed for moisturization. So I found a research technician, I found a lab. And at first it was just sort of, okay, this is a cool side project. I was working full time as a consultant surgeon. I was brand new. And so little by little, I was making little pots, investigating ingredients. It literally was in the kitchen. And then I sort of played around with it. I loved the textures. I loved the smells. It was really something that didn't exist. I couldn't find it in a shop. I took a business coach. And at that moment, it was all just sort of, well, let's see how far we can go with this. And then, well, actually, I thought one day, and I can't even remember when, but it was sort of this gradual build up. I thought, actually, well, let's go all the way. It doesn't exist. And there we go.
So from experimenting in the kitchen to getting it online and to retail, how long did that process take?
Years, really years, probably about 2 to 3 years, finding the lab, understanding how those things work. I'm a surgeon. I don't know anything about business. I took a business coach, market studies, all these things like that probably are natural to some, just were not natural to me. So all of that took 12, 24 months. Finding a lab actually took a long time. Engaging a research scientist, creating, recreating, finding the textures that we wanted, finding the smells that we wanted, and then testing it. So who are we testing it with? where are we testing it? How are we going to do it? So really from ideation to actual product on the shelf was probably about 3 years.
Okay.
And our clinical study hadn't even started then, actually. So it's years.
So it's been a labor of love.
It's been a labor of love. And it's a bit like medicine. You sort of start it not realizing how much work it's going to be.
Well, if you know how much work is actually going to take, you would never do it. I always say this about anybody that's an entrepreneur running their own business. If you know how much work.
Yeah. Because it's endless.
It's endless.
I remember the business coach actually said to me, how much are you willing to put into the company? And I said, okay, let's go 20,000. There's no way. There's no way. I mean, that was her failure as a business coach already. Number one, she agreed that was kind of the limit. Well, actually,
the rest.
Endless.
And the rest.
It's endless. Time and money. So it has to be a labor of love. But I've always believed in the project. I believe in it more today than I ever did before. I feel like we're in the right time, right moment. And we're at the forefront, really, of dermocosmetics for dogs.
Amazing. We'll get back to why you feel like that's the right time right now and you believe in it more than ever. But how did you, being a surgeon, actually help this process, if at all?
It definitely helped because you can't stop. It's exhausting. And often when it requires so much discipline. It requires so much self-motivation. And the sales are not just going to fall from the sky. You have to keep going. You have to keep looking. You have to keep thinking. You have to keep moving. And I feel like surgery gave me that discipline because you keep going. I remember studying, 20 hours a day for my final exam. And I know that that's the same mentality. And I feel like, because I understand what that was like, I understand how I can work as an entrepreneur, as a business owner. And that actually, at the end of the day, you reap what you sow and it will come.
Right. Completely. So let's go back to this point, because I found that very interesting, because I know that we all go through like ebbs and flows, whether you're, in a workplace or whether you have your own business. And there's a moment sometimes where things just, you lack inspiration, you feel like giving up, things don't feel in alignment anymore. However, you've just said that now you believe in it more than ever. Tell me why. I'm very intrigued to hear this.
Well, culturally, anyone who owns a dog has seen the way that the culture has changed in terms of dog ownership. Actually, you don't even have to be a dog owner. You just have to be a human being to see that actually people on the street with their dogs. You came in with Chubs on a pram. People are not having children. Young people are not having children anymore. They're more likely to have a dog. In certain parts of the world, there are more dogs than there are children under 14. So they've taken this huge cultural importance, so societal importance, actually regardless of generation. There's a lot of talk about how it's sort of younger people, but actually it's the same for empty nesters, people whose children have left home. And COVID, they took such a huge part in our lives. They gave us happiness. And we feel like we owe them. And they're wonderful creatures. I mean, how many people have before me said that actually they're better than humans?
I've said
that. They give unconditional love.
I've said that at least 4 times today.
Yeah, exactly.
In conversations.
Exactly.
And I mean it.
Of course. In your unbiased opinion.
Yeah.
So, culturally, it's the right time. And even scientifically, if we think about the way the vet industry and the management of dogs with skin disease is changing, historically, it was always very heavily medication, steroids, immune modulators. And now it's evident that there's a place for moisturization and a place for skincare. If you look at human guidelines, skincare, moisturization is the foundation of care, actually. And if we know that dogs and humans have the same skin, then we can automatically withdraw that, or we should be able to. But for some reason, there's been a delay to that. And now we're working in France with some of the top veterinary dermatologists, and really we're taking a place for maintenance. We're not saying that we should replace medication, but we're saying actually there's a place for maintenance, even of hygiene, of moisturization. We still have people who think that you shouldn't wash your dog more than once a month or once every 3 months. So it's changing.
Okay. So you can see, obviously, culturally how it's shifted and how people are viewing their dogs basically as their children, as their family, very emotional. Not to say people didn't feel that way, but how we're acting with our dogs are very differently. So for those that may not know, who are listening, that may not know what dermatitis actually is, could you actually explain that for us?
It's basically inflammation of the skin. That's really what it translates to. So it might be a red patch. It might be, and actually in dogs, you might not even see the red patch. They might be itching and scratching. They might be licking their paws. But it's basically inflammation of the skin caused by a variety of different factors. It could be a grass allergy. It could be a food allergy. It could be canine atopic dermatitis, which is more genetic. But it is an inflammatory disorder of the skin. And specifically for canine atopic dermatitis, which is very common in Frenchies, as you know, it's a primary problem in the skin barrier. And you're a human. I'm sure you've been to a pharmacy with pictures of the skin barrier on the wall, and dog skin barriers look exactly the same. And if our skin barrier is dehydrated and you see that the moisture replenishes it and fortifies the skin barrier, it's exactly the same for dogs. That's well established. But people say, well, I mean, that's kind of silly. How do you moisturize a dog? But it's like your scalp. When your scalp's dry and you've got dandruff or it's itchy, you use a moisturizing shampoo. So this is the principle of our skincare.
Yeah, basically the skin barrier is not different.
That's right.
So we treat it exactly the same.
That's right. And it's so important. They're close to the ground. They're exposed to allergens all the time, to grass, to dust. And we forget how important it is. And people think that it's normal for a dog to scratch or bite. Actually, that's just normal. Okay, fine. Well, it is normal a little bit, but not to the point that it's disrupting their meals or waking people up from sleep.
Yeah, or their life quality.
Especially.
Yeah, the quality of life shouldn't be affected.
Yeah,
because of itching.
Yeah.
So, in terms of if people are concerned that their dog may have dermatitis, what are some of the things that they should be looking out for?
Well, I mean, dermatitis, and if we're talking about canine atopic dermatitis specifically, because of course you've got the dogs who have an occasional allergy or an occasional dermatitis, they might have run through something specific, or it might be seasonal. Then you've got these dogs who really do have true canine atopic dermatitis, and that's expensive. So often, it's itching and biting, it's scratching, it's recurrent infections, recurrent skin breakdown, it's itching the paws. They might even have ear manifestations as a spectrum of that. That's a difficult, or it can be a difficult problem to manage. And I always say it's like I would tell a human patient with a long-term chronic problem, actually, this is a problem you need to manage lifelong. And often there's a lot of trial and error. The problem is that people go into this unprepared, I think, and they probably don't get the right information. Actually, if you're prepared and you're told that this is a long journey, that there's going to be some trial and error, that there's going to be some food testing and elimination involved, that actually we've got to treat the skin barrier right, that there might be flare-ups, that you might be back and forth, but we're trying to have this balance where you live your best life, then people might actually understand.
Yeah, understanding it's not a quick fix.
Totally.
And you have to actually make environmental changes, the nutrition changes where needed, and you have to really see this as something
A
that
long
you have
term.
a long term. Yeah.
Yeah, a long term. But the single most important thing you can do is actually invest in some good skincare, good hygiene, moisturizing skincare, skin barrier protection like we do for ourselves. If I go lie in the grass, I'm going to come back itchy as well.
Yeah, no brainer.
No brainer.
So what's the worst case that you have come across?
um, if we're talking about dogs that we've been involved with, so it was really important for me to demonstrate that we work. Actually, you can find lots of shampoos and lots of products on the shelf, and they're a dime a dozen. You don't know what they do. All of them say they're cleansing or antiseptic. They've got tea tree. They've got whatever. But actually, it was really important, number one, that it was hydrating and moisturizing. So I chose the best ingredients and that we demonstrated that we work. So we worked with vets to run a clinical study of dogs coming through the clinic with dermatitis, managed only with our products. And all dogs had a degree of improvement, some more than others, of course. But what was remarkable was that even dogs with severe skin problems, i.e., itching, scratching, can't even eat because of it, had an improvement. So to go back to the original question, which was, what is it most severe case? In this clinical study, the vets were allowed to choose who to treat and not to treat. And I was traveling, I think I was in Japan at this time, and the vet sent me a photo of a dog, and it was a bulldog with horrible dermatitis, horrible, total body. The skin was thick, red, hot. You can imagine how uncomfortable and distressed the dog was. But the dog mum, she was tired of the drugs and the antibiotics, which were not working. And so they were very, very, very invested in trying something different. So the vet sent me the picture, said, this is what we are going to do next. And my heart sank. Actually, it broke. And I thought, this is setting us up for failure. It's not going to work. Number one, the pet mother has to be super invested, has to be super motivated to be washing and moisturizing all the time, which of course people find difficult. And it's a severe case. The dog probably does need drugs. But they persisted, and lo and behold, after 3 weeks, perfect. No problem. No drugs. Skin was back to normal colored, white. The skin was thinner. The folds weren't so thick. And
amazing. I mean, and have they continued? Have you followed up with them?
Yeah.
They've continued,
Yep.
and no drugs at all.
No drugs at all. Of course, in the summer, when it's predictable, there's lots of allergens in the air, the dog's running outside, of course. But in the winter months, well controlled, no longer needing Cytopoint every month, and actually really invested in skincare.
First of all, I love the name, The Fur Love.
I do.
Yeah. So tell me, how did you come up with it?
Actually, it's a funny story. And because it's funny, even because I was looking at it last week, thinking about how we came up with the name. And originally, what I wanted was fur. I just wanted fur. This was now 5 or 6 years ago. And I looked to patent the name, but the name belonged to a company. And if you love human skin products, then you might know this brand. And it is called Fur. And they specialize in pubic hair. This is how they started. And they won, I think, $500,000 on Shark Tank in the Shark Tank is USA, isn't it?
Yes, it is.
And they're huge. But fur was taken, and Fur Love just made sense. I wanted fur in there, and Fur Love made sense. So
I think the love adds the warmth.
Yes.
I'm happy that it was taken so that you got Fur Love. The Fur Love. I love it. Yeah. And I know ingredients. You're like an ingredients nerd, and this is what I love about the brand is that you can tell everything's been thought through, handpicked. So tell me, what are some of your favorite ingredients that you've used across the brands?
Well, actually, it's quite disgustingly simple. I'm originally from the islands. I'm from Samoa, which is an island in the South Pacific. And you grow up with coconuts everywhere, of course.
Yeah.
But it's so special because it's an we used it as kids for mosquitoes. You use it as a moisturizer. You use it for anything, basically. And on top of that, there is evidence that it has good, of course, moisturizing capability and some natural anti-staphylococcus activity. So actually, it's proven in clinical studies to be effective for skincare, improving the skin barrier. And so it was a no-brainer for me. And I love the smell. I love the richness. And I grew up with it. So it's like my background. And for that reason, one of my favorite products is a conditioning mask, which has coconut oil in it. And it's so rich. And I knew that I wanted a conditioner for Charlie because she was a Labradoodle with a wiry coat. And when we were washing her with Meliseb, her coat was dry, horrible. And I knew I wanted something rich and nourishing.
Can we talk about what Meliseb is for those that may not know?
So basically, it's a chlorhexidine-based shampoo. And it's great for infection. It's the most commonly prescribed veterinary shampoo in the world. And like I said, it's great for infection, but it's not great for long-term maintenance. It's got antibacterial activity. And by nature, it's drying. Let me tell you, as a surgeon, we use chlorhexidine in the operating block to wash our hands in between cases, before cases. And it breaks down the skin on our hands. And in between washes, we have to moisturize like crazy to maintain our hands in good condition. Otherwise, they crack, they're broken, they're painful. And so this is what dogs are being washed, or not dogs, because actually I think it's prescribed for horses and cats. But my love is dogs. So this was the most commonly prescribed shampoo, and Charlie was prescribed it all the time as a no-brainer. She was getting this all the time. Her coat and skin was not good, and I really knew that she needed something nourishing and rich. The way if I had a dry scalp or dry hair, would go and find a Stars or whatever,
like just moisturizing, hydrating.
Exactly.
Yeah.
And it didn't exist.
So why would we give our dogs anything less?
Right, exactly.
On a long-term basis.
Exactly.
Like you said, drugs and, things that are a tiny bit harsher completely have their place, but for a short-term use.
Totally.
So going back to ingredients. So tell me some more on another ingredient. So we've got coconuts.
Manuka honey. I'm from New Zealand. Manuka honey, as a surgeon, we used to use it on wounds that were non-healing. I remember I had a patient she had Crohn's disease. She had wounds on her abdomen. They were not healing. And so we used Manuka honey every day, twice a day, to put on her wound to improve healing. And it works. And we know that. So Manuka honey is native to New Zealand, and Australia might argue, but it's definitely native to New Zealand. And there's antioxidant, antibacterial activity depending on how strong you buy it. So ours is medical grade. We want to have those properties. We want to be able to say, actually, we've chosen the best, number one. And number two, we've demonstrated that it works. So Manuka honey is another favorite ingredient. And then in the balm is beeswax, and that's just a barrier. Dogs, when they're close to the ground, a Frenchie, a Dachshund, they're very close to the ground. They often get eczema and dermatitis over their abdomen, of course, because they're touching the grass. So the idea for beeswax is simple. It's just a barrier, actually. It maintains the moisture and hopefully reduces the flare-ups every time they're going outside to run the grass. We actually, you've got a lot of people who say, well, I don't let my dog go outside on the grass because every time they come in, they have a flare. I mean, that's miserable. They want to run outside.
Yeah.
Manage them. Wash them.
Yeah.
Use moisturizing products. Use a protective balm, so they can live their best lives.
Yeah, to eliminate taking things away from them,
totally.
Running on the grass. Yeah, they have to have playtime.
Yeah.
So touching on that, what would you say is like a 10 out of 10 routine in terms of hygiene and avoiding, dogs getting itchy and obviously some things you can't avoid environmentally. But what would be a good daily routine that you would recommend for dog parents out there?
I mean, doing something is better than nothing, actually. Just thinking about it, I think will make a difference because you're thinking about it, you're going to do something. Okay, if I'm going to go and be pretty extreme, actually, it's not a bad thing to wash your dog frequently. You just have to have the right products. In France, there's a veterinary dermatologist called Dr. Bensignor. He wrote a book, and actually he also recommends our products. He wrote a book about dermocosmetics and about dogs with dermatitis. And he says, number one, you should double cleanse.
Mm-hmm.
And as a woman, I totally understand double cleansing. I'm like a major double cleanser. First of all, to get all the debris off the coat. And second, to allow the actives and the moisturizing agents to actually penetrate. So extreme routine, my end, the full Monty. And I would do that when Charlie was flaring up. I would do that twice a week. And actually, he recommends shampooing twice a week for dogs with dermatitis. You just have to have the right products. Obviously, you're not going to be washing with chlorhexidine-based shampoos every day. But if you're using moisturizing, hydrating products that are replenishing the skin barrier, then do it every day. As a routine, I would do a shampoo and a mask at least once or twice a week. Moisturizing the pores and the exposed areas. For Charlie, it was her abdomen, her armpits, even around her genitals. She was always licking, and often that's another thing, not just the pores, but licking the genitals. And then if you're not wanting to shampoo and mask, then using the spritz, or even, okay, fine, if you're not going to buy the spritz or buy something to wash, just get a wet towel and wipe them down and wipe off the dander and the pollen and just those things that are irritating them. It makes sense. Like I said, if you're going to go and roll in the grass yourself and not shower that night and maybe not shower for a couple of weeks but roll in the grass every day, you're going to be itchy too. It's a no-brainer.
Yeah, completely. So just a short version of that little summary. Let's just say I am a time-stretched dog mum, which I am, but I also have loads of time for Chubby anyway. But say that I don't have the time to invest in a really rigorous routine. A short version, something quick, easy that I can do daily, weekly, give me what I need to do.
Okay. I would take the spritz. I would spritz him down all over like you would for your hair. Wipe him down. Make sure you're wiping and brushing because actually we want to be removing the pollen, the dander, the dirt, the dust as much as possible. I know Chubb, so I know he needs a pore soak. You don't have time for a pore soak, but put a little in a bowl, make up the solution, get a wet flannel, like a nice wet, soggy wet flannel, and wipe his pores. The beauty of the soak is that it's alkaline. It reduces inflammation, reduces redness, and just that can help reduce the irritation in the pores themselves. And then he needs moisture. So balm. Actually, we've got a lot of people who like to mix the balm and oil because they prefer the texture of the two together.
Yeah.
And then massaging into the body, massaging into the skin. You really want to get into the base of the coat. It's not just the fur. Actually, it's really into that skin.
Just like us.
Yeah, just like us. And over his belly and his paws, the most vulnerable areas.
Yeah, belly and the paws. Okay, so working on building the fur love, what has been one of your biggest lessons that you've learned so far?
Oh, probably listening to people who tell me what I should do. Yeah, because a lot of people tell you what you should do and what you did wrong. And I'm probably a good victim for that because I'm always seeking advice and I'm always seeking information. And in medicine, I accept that I don't know everything. My specialty is very narrow. It's general surgery. And outside of that, I seek advice. And that's normal practice. But everyone's got an opinion when you're doing business or starting a business. So that's my biggest It's not a regret. It's just something I learned. I go to a website developer and he tells me who the hell made your website. It doesn't work. You need to do it this way. It should have been done this way. Here you go. Here's the bill. We need to do it all over again and make it better for you.
Right.
And that happens over and over and over again. And it's taken years for me to be a bit more savvy about that and trust myself and know that actually there is no right answer. And I will understand what I need to achieve and find the person that can make that happen for me.
Trust in your intuition and what you know is already the right route.
Yeah.
What do you want the Fur Love legacy to be?
That we changed skincare for dogs, actually, that we were the start of it. We've got a lot of human trusted brands. If you think about household brands, shampoos, soaps, skincare, and there's nothing like that for dogs, actually. There's so much out on the shelf and it's full and it's crowded, but there's no one who's telling you, who's making you feel confident in what you're buying, to have in your house, to wash your dog with, and this is what we're working on. And this is why it's been so important for me to work with vets, because we have to have their trust. And we have to have their recommendation.
Yeah, and that's really important as well. So tell me about that journey with working with vets. So you're coming in with a very almost opposite approach to what they're used to. So what have been the pros and the cons with working with vets in that area?
For me, it made sense because I am scientific and I know what they need to know. I know what they need to sell, but it doesn't work that way. You can have what they need and they still need more. Okay, I'm a bit of a skeptic. I understand what it's like for people to come into the operating theater and tell me what I should be doing, and so I understand it. But for me, I feel like it's been a bit slow for them to say, well, yes, dogs, they have the same skin as humans, and therefore we should be managing these skin problems the same way. They've been slow to say, yes, we need moisturization and good skincare. Yet as a routine, they will say, we need to manage the diet, but diet only makes up 5% of true skin allergy. So I feel like there's been a bit of hesitation or skepticism to recommend, good skincare, and probably that's driven largely by the idea that they think that dog owners are not going to be invested in doing those sorts of things. Right. And it's the same as humans. My goodness, we have many many diseases which are related to behavior. Okay, let's take smoking. Let's take, eating poorly. Let's, even dermatitis in humans is difficult to manage because people really need to be invested in the care. So of course, if dogs are depending on humans to do it, then we're going to have the same problem. But doesn't mean that we shouldn't be promoting it.
Yeah. What strikes me though is if the vet industry understand the cultural shift, they'll also understand that dog parents are invested in taking care of their dogs and having the time to do it.
Plus, it's time, actually. They're time pressured. They're hugely time pressured. And a vet consult for skin is not 5 minutes. A vet consult for a Cytopoint injection is. But a vet consult for behavioral change, for skin routines, for hydration, and it's not always evident to people, actually. So it really does take the time, and unfortunately, they don't always have the time.
Yeah. What would you recommend to a dog parent, or just general advice going in to deal with a skin issue with a vet, to actually come out with the right outcomes, as well as using, say, products like yours? Because I've had my own experiences with Chubbs, who has had allergies his whole life. And it is a merry-go-round. I wish I met you 9 years ago when I was going through this.
I mean, as for anything in health, and I'm going to talk about, I'm going to relate this back to human health. If you are not happy, if you're not clicking, then seek another opinion. Yeah. You don't have to feel like you have to be with this particular health professional or animal health professional. Number one, and trust your instinct and know that it's going to be a long path. I mean, you don't always know that at the start, right. But I think more and more people do, particularly in at-risk breeds. Of course, if you're buying a Frenchie, you know that you're going to have X, Y, Z.
Well, if you've done your research, not everybody does. If you've done
your research, yeah. And of course, we assume that people do, but they don't always know. And so, okay, whose responsibility is that? Is that the responsibility of breeders, people who are the marketplace, for want of a better word? But it is a long journey, and I think you really have to find the right vet for you. The biggest source of dissatisfaction is really not managing expectation well. We spoke about that at the beginning. If you understand what the journey is going to be like, and you feel like your vet's listening to you, then okay, we're in this together. But if you're just in 2 to 5 minutes and you're out and you had the injection and you didn't really have your questions answered, then find somebody else. Okay. I know that's easier said than done, but we would do it for ourselves, to be honest.
Sure.
I would certainly advocate that for anybody.
Yeah. So how do we balance? We spoke about medication having its place. So how do we balance that? So say, okay, I've started using the Fur Love, and it's definitely working, but I need Chubbs to stop itching a bit faster. And I'm like, how do I balance maybe medication here and there with using, skincare for dogs as well?
I mean, the two should go together, actually. It's not one or the other. We know that there can be breakthrough infections, even when dogs are using Cytopoint. And there's some idea or thought that actually it's because people are not washing, and therefore it's a hygiene problem, and therefore you have bacterial overgrowth. Because of course, if the dog's not itching, you think, "Halas, it's done. I don't need to do anything at the moment." But the two go hand in hand. And as you say, you need Chubbs, theoretically, to stop itching a bit faster. Okay, well, grab him the Cytopoint so that he itches a bit less and he's a bit more comfortable, and start the skin routine. And the idea, and there is already some evidence, and we demonstrated in our study, that if we are doing this every day, moisturizing, hydrating, then actually your requirement for injections in the future is less. Of course, we know, like we said before, the summer months it'll flare up, but hopefully 6 to 9 months out of the year, it's just managed well with good hydration, topically, and moisturization.
What were some of the highlights that came out of your study that were surprising?
That all dogs had an improvement, actually. Even we had dogs, the vets made the decision, but we asked the parents to rate the severity of symptoms according to how frequently they were itching and scratching. Was it interrupting their mealtime? Was it interrupting their sleep time? And even the dogs who were the most severe in terms of symptoms had a 60% improvement after 5 days of using the products. So shampoo, mask, we're not going to make it 100% better for the dogs with severe symptoms.
60% is pretty good.
60% is still really good. That was surprising for me. Actually, that was a huge insight. But like you said at the beginning, you have to do it frequently to see the results. It's not like a one shot wonder, just like for ourselves, actually. It's
commitment.
Routine every day.
Skincare.
I mean, we know the human skincare industry.
Yeah.
So we've got a lot of room to move, actually. There's a lot we can do for our these
furry friends.
Yeah, of course, these creatures that take so much space in our heart.
And how effective do you feel when you have the medication and Fur Love together, for example, or skincare ranges in general that work, are we getting to more like 80%, 100%? How would you kind of gauge that combined effectiveness of medication and the products?
Okay, let's talk about what we're trying to achieve. The products, so Cytopoint, steroids, antibiotics. Antibiotics treat infection, steroids reduce inflammation, and Cytopoint stops itch. Okay, we said that the primary problem here is the skin barrier, and none of those three
are tackling that.
Change the skin barrier. Actually, the only thing that changes the skin barrier is moisturization, and it's the same for humans. It's well established. The only treatment modality or management modality that can alter the structural layers of the skin barrier is daily moisturization. So Cytopoint's a wonderful drug, and steroids and antibiotics are wonderful drugs, but actually for improving the quality of the skin barrier and reducing the requirement for drugs, moisturization is key.
Okay, moisturize with the right things.
With the right products. And we know in humans, actually, when you're moisturizing, and this might be what you were asking, when we're moisturizing regularly, then oh my God, I've got the French word in my head.
Guess it out.
Yes. We prevent drugs in 60% of humans being moisturized on a regular basis, which means that 20 to 30% of humans require drugs. If all dermatitis patients are being moisturized. And okay, let's assume it's the same for dogs, actually.
So something I think about, your relationship with dogs, has that changed at all since building the brand?
Oh, yes. Actually, it changed when I had my dog, because we grew up with dogs on the islands, and if you've been to the Pacific Islands, and probably not really limited to the Pacific Islands, there are dogs everywhere. There are strays everywhere, and so you learn to be afraid of dogs because they chase you on the street at night. I've been bitten by dogs twice in my youth, so you grow up not really wanting a dog around you. And then when I was studying, I was finishing my surgical training, and my son, he would have been sort of 12, 13 at the time, I think, maybe a little bit younger. He wanted a dog. And I thought, I'm never going to have a dog.
Oh, wow. Yeah. I didn't know this about you.
So this was, I was maybe 30 at the time. And he wanted a dog. And then I finished my surgical training, and I felt like I owed him because he'd lived a rough life as well. I'd studied for 2 years to get through my surgical exam. I locked the door. I said, don't come into this room while I'm studying unless there's an emergency. So we were in the same house, and I was behind the door. Yeah. So I felt like I owed him. Right. So I bought him a dog. As these things turn out normally, he's not the one looking after the dog. I am.
You. Yeah.
But actually, yeah, she changed my life.
And in terms of the suffering that they go through because of things like dermatitis, has that impacted you or opened your eyes even more to see what dogs go through?
Yeah, absolutely. I mean, she was, and they don't complain, of course. Number one, they can't. They rely on us so much to protect them, to understand them, to know when they're in pain, to know when they're in discomfort. So, of course, it made me aware that she had been going through so much, and actually it was my job to make things better for her. And actually I could do that simply. This is the whole thing. We can do that simply by instituting a good shampoo conditioner regime, you know? Yeah. It's a simple change that we can make to make them more comfortable.
Yeah, it's not as hard as we think.
It's not as hard as we think. And it's not as hard as a lot of vets think, actually.
Right.
If you just offer it to people and tell people what they need to be doing, people might actually listen and want to do it.
My final question to you is, if dog parents could take away just one thing about their dog's skin care regime that they could do, or just one thing that you just think this is key, what would it be?
Well, if I'm talking about dogs with canine atopic dermatitis specifically, the key thing is that it's a journey. Actually, I think that if you understand that actually there's a lot of trial and error, and it's a long path, and it's a lifelong path, then and actually it's totally manageable. That would be the one key thing. That'd be the one key thing.
Stick with it.
Yeah, totally.
Stick with it. Yeah. Long-term plan.
Yeah.
No one's a magician.
Totally.
Let's work with our dogs and get just make things more comfortable and improve day by day.
Yeah. And it's trial and error.
Yeah.
There's a lot of trial and error, but you have to be invested in that journey actually and find the vet that suits you and fits you.
Amazing. That's all been wonderful information. And I know that that's helped so many people listening. And I know that this is such a common thing. Like people go round in circles and it's horrible. And it's horrible watching them suffer.
And it's expensive.
It really is. So, where can people find you and find more about information about The Fur Love?
So you can find us on the World Wide Web at www.thefurlove.com.
So thefurlove.com. It has been an absolute pleasure.
Thank you. For me too.
Because I've been on my skincare journey with Chubbs and, his dermatitis journey, I really, I know quite a lot, but I'm always learning, and you've definitely given me some even better pointers so that I can improve his skincare journey. Do you want
he's well loved. He's well loved.
He is well loved. You want your skincare journey to be even better. What is it now? Do you think it's a 10 or an 8? 10. Okay, I'll take that. But thank you so much, Ineke. It's been amazing. And thanks so much for being on the Dog Mum podcast.
Thank you. Thanks for having me.
Thank you.